Well, yes, I am. Okay, welcome. Dorset stakeholder meeting. Sorry for the fact that it was had to rearrange, unavoidable, and that's also the reason why we're in here today rather than committee room run. So we open with apologies. I believe we do have at least one.
Apologies from Councillor Jill Taylor.
And Councillor Wilson is attending online. The minutes from the last meeting, which was the two sets of minutes, 2nd of December 24 and the 15th of January 25. Everybody happy with those? Yep. I'll sign those later. Item 3, declarations of interest. Any declarations of interest from members of the stakeholder panel? Nope. Item 4, public participation. There are no questions or statements received from the public or local organisations. Item number 5 is questions from councillors, and we haven't received any. Item 6 is the forward plan, which is in the agenda. Anybody want to raise any comments on that? Nope. So item 7, the first paper proper, is Commissioner's update and presented by Mr. Mark Tyson.
Thank you, Chair. So Mark Tyson, Corporate Director for Commissioning and Improvement for Adult Services for Dorset Council. As usual in these meetings, we've got a short report that gives a roundup of some of the relevant sort of business and developments from the perspective of the Commissioner as they affect Care Dorset. I won't pull out all of them in presenting. I think the first one, though, and probably one of the most significant that we're working on at the moment, and many people will have seen some press coverage about a consultation on the future of day services. So firstly, to put on record our thanks to the staff in the day centres that we have been visiting and working with to have the conversations about the future of these services. We have been to the centres in the north, east and Purbeck areas of the county. After Easter, we will be in Bridport, Dorchester, Weymouth to conclude all of the conversations. To just recap, so for people's context, we've done 2 big pieces of engagement work, shaped a model of day services out of that, which talks about hubs and spokes and about coordinating in local geography and trying to improve the variety of the offer. And this part of the process now is formal consultation on a set of proposals, a set of initial ideas about what that means for particular places and localities, and particularly focused around our biggest contract, which is with Care Dorset for the delivery of the current day centres. I won't, at this point, I don't want to preempt, obviously, as we get through, and we've got lots more conversations yet to have, but I will say that the conversations have been incredibly helpful. I've said thanks to the Care Dorset staff, but a particular thanks, of course, to everybody who's actually come out and talked to us and engaged with us. It's been an incredibly rich conversation. We've learnt a lot more about what's happening in the centres beyond things you can put on paper, like data and numbers and costs and so on. But we've learnt very much more about how they fit into local community life. I think that's been really rich, and I think if I'd single out 2, I think that really shifted our perspective. One would be Blandford and one would be Wareham. I think actually just very interesting conversations we had in both of those centres, across all of them actually we've had, at Shaftesbury as well, similarly. So, I think, and particularly Blandford, I would suggest, absolutely completely changed some of our thinking about what that could be and how we could use the space differently, and we're starting to put together ideas that respond to what people told us. And the reason I single that out is because I think it's really important to just emphasise genuinely that this is a consultation, and we wanted to start with a set of proposals and then explore and open out what that looked like and how well we thought that could work in different places. So really thank you to everybody who's engaged with that. It's been very rich, interesting, and I think we're going to come back with some really good plans. And so we're going to do some, when we've done our consultation work, we'll come back with some work with the centre managers for Care Dorset and do some work together on that, and then emerge into Cabinet with a set of proposals after those conversations have concluded. So that's into the probably early autumn or late summer. So ongoing piece of work. The reablement work I've just singled out here just to note that we're doing a piece of work as part of our next year's transformation plans around thinking more about using reablement at the front door of adult social care, not only in effect the back door of hospital. I'm working with Care Dorset on that, and that is looking at how we can make sure anybody who comes through adult social care services is optimised, if that makes sense, when we do the assessment. So they're the best and the strongest and the most kind of independent they can be when we do the assessment, and then we can get the right care and support for them when we've done the assessment. And that'd be really valuable, I think, in the long term, and is a good partnership between the council's services and Care Dorset to deliver that. I've put then a few, and I've kind of noted Castleman House at the time of the report had come through, and it's good findings. I'm sure more will come out of Care Dorset's update on that. And then just some of the wider context on the budget and medium-term financial plan and some of the related transformation programmes for our future council, for what the council is, for what adult social care is doing to transform, and also the future care programme across the integrated care system, which is looking to change the whole set of services and reconfigure the system around how people move in and out of hospital in times of crisis and how they're supported back onto their feet. So that's an important set of developments because it wraps around how Care Dorset at the moment provide their reablement beds and their reablement community offer. So Care Dorset is very much in the conversations with us. And so I think at that point I'll just pause and if there's any questions on that.
Thank you, Mark. I did have a couple of questions, but you've answered them all. I think, apart from one, which was, is there any update on Sydney Gale? It says you're in REBA phase 2, wherever that means, design, I guess. When are we likely to see, bricks going up and wherever that's building, basically?
So I think the first part is bricks coming down. So we're in the procurement phase for demolition of the current site. There's been quite a bit of work done on the configuration, on the model, on the design. We've partnered with Stirling University, who are kind of top of the class, as it were, in dementia care environments, and so they've helped advise on what would make that optimum. So there's a lot of that preparatory work, which is the REBA stage 2, but the big bit to get done now is the procurement of the demolition of the current site and clearance, and then be ready for the next stage, which is into the summer for starting the planning process. There's already the early conversations happening on the kind of planning advice, and that will come through in the coming months.
Councillor Somper, I see your hand up.
Thank you. Yes. Somper with shingles. Ooh, sorry. Thank you very much, Mark. Lots of interesting information there and really helpful. Really enjoy reading these reports and look forward to hearing all the various outcomes as they go through their stages. You mentioned some of the day centres in particular. I won't go into details of those particular ones that you mentioned, but you did say that you weren't aware of all the services and all the activities that were going on in these centres. And I wonder why that is.
Thank you for that question. And I think some of it is about the kind of flexibility with which people engage in some of the activities in the centre. So some of it is, so if I take a bit of a crude breakdown of it, so we commission places at a day centre in the kind of strict form. Some people self-fund, and we know about the numbers of those broadly from Care Dorset, but then there's other kind of groups that access services there. Some of those are regular, some of those are less kind of routine, they're kind of one-offs. And I think then we also saw and have talked to people, and I think this was part of what we weren't quite appreciating, people coming in for lunch, for example, which is not a kind of sessional thing, but clearly it's of great value for a kind of social connectedness. And so it triggers us to be thinking about which was always in our model, but it changes the balance of thinking about what these centres do for sessional day service activity, if you like, that we commission or people buy themselves, versus how they perform a role in connecting community activity. And those are sort of different and sort of softer social isolation outcomes, which I say softer, that's not to kind of downplay them, but we just need to think about how we plan and commission for those in ways that we know what outcomes we're buying, if that makes sense, rather than it all being on the day services kind of ticket.
Thank you.
Help? Is that
well, thank you. Sorry, Chair, if I may. No, it's helpful for that explanation, and also really encouraging also to hear you talking about that flexibility and those unique, quirky uses that some of the day centres are used for that, as you said, you weren't aware of, and how vital those are, because we're all unique and we want different things from different services. And I know the whole premise has been on, it's not a one size fits all, and it's not just building based. No, it isn't, but there's also an attraction of a building where people can come together to carry out whatever activity it is, or simply from a social level. So I'm really encouraged to hear you say that. Thank you, Mark.
Thank you, Councillor Sampo. Any other questions for Mark? Nope. In which case, I thank you. And the next item is the Care Dorset update, which is going to be presented by Chris Best and Caroline Tapster.
Thank you very much, Chairman. I'm Caroline Tapster. I'm the chair of Care Dorset, and as usual, I'll just say a few words by way of introduction and then hand over to Chris to talk about the detail of the report. I'd just like to draw your attention to section 18 on governance. As you will know, we've been doing a lot of work on generally improving our governance arrangements at Care Dorset. And we have introduced a number of internal committees that are listed here, which are reporting directly to the board. Each committee is chaired by a member of the senior executive team, and that's going to provide us with much more assurance than an overarching managing director's report, which is what we've had up to now. And we've had our first round of those committees reporting back to us. We've also mentioned the new non-executive director that we're just about recruiting to. This will be somebody with a clinical background. I'm hopeful that maybe an ex-director of nursing or somebody with a similar sort of background with board experience who can join us. That would then bring the number of non-executive directors on our board to 4, myself as chair, and then 2 executive directors. And I think that's sort of appropriate for the size of business that we are. And we are appointing a clinical lead to Streets Meadow. And we have talked before, and I know this is something that you are really interested in, how we can actually strengthen our clinical governance, bearing in mind we do want to be providing more nursing care and the higher acuity of many of the people who are receiving services. And then finally, we have appointed a new finance director, Lisa Evans, who has already started with us. And tomorrow we are interviewing for a chief commercial officer. This is our second go. These people are quite hard to come by. I think they can get paid quite a lot of money in other places. So we are having to compete, but I'm confident we've got some good people that we're seeing, and that will then complete the senior leadership team, which will be excellent news. People we support, a little bit about engagement with our service users. That's in section 26. We have completed a survey of stakeholders, 300 responses, mainly in day services. That's where most of the responses have come, but across the piece, also residential care, supported living, which is really good, although we do want to increase that next time around. very positive on the whole. And what we are doing is we are giving back the results to each one of our units, so local managers can, where we can feed back to them, they can make necessary changes. And some of those are quite quick changes that we can make. So we can say, you said, we did, and demonstrate that by taking part in the survey, something does change. We also want to see what we can do to increase the response rate as well. But I think this is a good start, and we were pleased to see this. Chris, over to you.
Thank you, Caroline. Chris Best, Managing Director of Care Dorset. Just a couple of points I wanted to draw the committee's attention to. First of all, paragraph 13, as Mark was indicating there, over this reporting period, recognising the paper was written just over a month ago, colleagues, that we've had the regulator's report for Castleman House, which is good in all domains, that we were very pleased to see, and the report for the second location is still pending, but we expect that to be published in the coming weeks. Just in terms of workforce, we were pleased to see that voluntary turnover has reduced over the last 3 months, and I think that is in part to the introduction of our new induction programme, as well as referenced in paragraph 17. And then finally, just drawing the committee's attention to property matters. We've had some productive conversations with our place directorate colleagues in relation to the occupation agreement, and hope to have that concluded shortly. And I'm also pleased to say that the fire prevention works in our residential care homes has now been completed, and the certification for that those works has now started to come in from our property colleagues. And that's sort of linked to the sort of reference in paragraph 25 to the big 6 property compliance areas. So fire safety is an improving picture as a result of those works. So I'll pause there for any questions, Chair.
I do have a few of my own. I guess the first one is the St Martin's occupancy, which is mentioned. So St Martin's is the new building in Gillingham. Is there a reason for that? Is it too expensive? I don't know. It's very nice. I've been around. So what is the reason for that? And how many are we to filling it, I guess, is the question.
Yeah, so there's some way to go in terms of filling that. So we've, I think we've got about 30 of the flats still to fill. Care Dorset is obviously the care provider, and the nominations process is run by Dorset Council on that, and we obviously provide the background support. But from talking to our commissioning colleagues, the fill rate is in line with the expectations that our commissioning colleagues had for the service.
I don't see any other hands up, so I'll continue. Has Ben got no hands up there? No. So fire doors, the report said it wasn't finished, but we're now delayed, so that's good to hear. And I guess the other thing I had was it was about the reablement occupancy and the issues with a particular GP practice. How does that? I don't understand how it works. So I guess could you maybe elaborate why a GP practice can stop all in one setting? I believe. And is there a way of putting something in place to make sure that doesn't happen again? I guess.
Thank you, Chair. Yes, so the challenge has been in a single location with a particular GP practice who was concerned about the sort of number of individuals that they would need to support following the sort of discharge from hospital. There have been a series of conversations that have taken place, both with the support of Dorset Council colleagues in trying to support that situation. We have been able to resolve the situation in part in terms of managing the needs of the individuals that are coming out of hospital, so that there isn't so much pressure on the GP practice. But it's not without its challenge, and that's clearly something that as we move forward with bedded reablement, something that we need to work with in terms of our primary care trust colleagues. Really.
So I guess I got a follow-up question. So there was a capacity issue with the GP surgeries. So are the GP surgeries commissioned to do this work, or is it voluntary or optional? And yeah.
Yeah, so they do receive a sum of money for having those individuals on their patient list. So we understand that it's a capacity issue in relation to that.
I don't see any other hands up, so I think... Oh, Richard's... Yeah.
Yes, so it's regarding the financial performance, and obviously that's sort of looking back to coming up to January 25. I just wonder whether you've sort of got a handle on the agency costs since then, and I'm assuming the new finance officer and commercial officer would help in some of those sort of stresses and strains. One would think, how are you looking for, how's it now? Has it improved since that?
Thank you, Councillor. So there are still some challenges with agency use. Obviously, we have sort of weathered the winter period that this report was over. The agency use is still higher than we had expected it and projected it to be, and there is a turnaround plan in place as part of that. We have engaged an organisation to help with managing the premium cost of agency, so that the overall value of the spend with those agencies will reduce as a result of that neutral vendor being imposed. But clearly, there is still work to be done in reducing the overall need for agency colleagues, and that is principally around how we roster our colleagues, as much as it is about the supply of our colleagues, and there is, as I say, there is further work to do. Our managers have a cap within which they have to work on a monthly basis, and there is some tightening up of that our Chief Operating Officer is undertaking. More broadly, as you say, when the Chief Commercial Officer comes in, and as set out elsewhere in the papers, we need to be growing as an organisation in order to manage those overhead costs as well.
I think we're... No more hands? Yeah, okay. Oh, Councillor Robinson.
Steve Robinson, portfolio holder for adult social care. Just to firstly commend the report on progress. I think it's very easy to set a company up and then just have it doing the same thing all day, every day. But the changes that you're making, particularly at governance level with the appointment of clinical directors, I think is very, very good practice and stands well for building solid foundations for the future. And also, I think it's worth highlighting pleasure at the CQC rating of good, which is not an easy thing to achieve. And again demonstrates ongoing progress. We don't yet know officially what the outcome for the most recent CQC inspection is, but I look forward to commending you again at the next meeting.
Thank you, Councillor Robinson. No hands up remotely, so I think we can draw this item to a close. Thank you. And there are no urgent items, which is the next item on the agenda. Item 10 is exempt business, so the Item 11 on the agenda, which is the Care Dorset Annual Business Plan 25-26, is scheduled to be considered under exempt business. The committee is asked to resolve the following recommendation, which I'll now read out, that in accordance with section... I'll put my glasses on, so I can't read it. I thought I could. That in accordance with the section 100A brackets 4 of the Local Government Act 1972, that we exclude the public from the meeting for the business specified in item number 11, because it is likely that if members of the public were present, there would be disclosure to them of exempt information as defined in paragraph 3 of part 1 of Schedule 12A to the Act, and that the public interest in withholding the information outweighs the public interest in disclosing the information to the public. So can I seek a seconder for that? A proposer and seconder? So Councillor Robinson, Councillor Biggs, thank you very much. In which case we'll end the live stream. So if you're watching online, goodbye.